patients are using AI, the healthcare system needs to accept that and work out how to leverage it more effectively.
Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data. Proudly brought to you by Pulse IT News. This is our Hot Topics show and I'm your host, Louise Schaefer.
And I'm your other host, George Margellis.
George, it was fun catching up with you at the Digital Health Festival. So many people.
It was big again. I don't think it was quite as big as last year, but I think it still had a lot of buzz. Lots of announcements, lots of booths, lots of people to see. Great dinner we had Wednesday night. Interesting, a few big announcements for standard nerds like me. Peter O'Halloran's announcement of the standards framework is interesting. But at the end of it all, I think we came out of it with a bit of a better view of where we're going in healthcare.
Yeah.
What do you think?
Oh, yeah. No, it was good. Yeah, I had a really busy couple of days, as everybody did, and I was on stage a few times.
And I have to say, you did a great job on stage and you look great in red.
Oh, thank you. I did get lots of compliments on my red suit, so I'll have to wear that one more often. But yeah, no, I thought it was really good. And yeah, shout out to Peter O'Halloran, because a couple of days after Digital Health Festival, I flew to Barcelona for the Health Revolution Congress, where I was catching up with Jessica Demis and attending that event there and speaking at it. And they wanted me to give an update on things that were happening in Australia. So Peter was very kind and shared his slide deck with me. So I grabbed a couple of the most recent announcements to let them know where we're going with our data standards. And of course, the interoperability framework and all of that sort of stuff. So yeah, people are really interested about what we're up to in Australia.
Excellent. Tell us a bit more about Barcelona. It sounds like a great title for a conference, Health Revolution. Viva la Revolution.
Yeah. Oh, my God. Yeah, so it was a really interesting event. And Jessica Demis was hosting the main stage in the auditorium. And look, the content was good and everything. But I must say, sometimes I regret that we don't do a video show, because then I could show everyone pictures. Yeah, the venue was so beautiful. It's the former Hospital de la Santa Cruz. And I think now it's called Hospital de Saint Paul. It was built in the early 1900s, and it is just the most beautiful building. It's actually a UNESCO World Heritage Site. And all the ceilings are all those vaulted ceilings, I think they call it, where they're all like little arches. Yeah, so the vaulted ceilings, where the main auditorium was, they had it all lit up with green laser lights and a little bit of smoke machines. So you could see this amazing venue and really show off the roof and the walls. And I'll put a link to it in the show notes if anyone wants to check it out online, because it's so beautiful. And of course, now it's the home of the Barcelona and Madrid Health Hub, as well as other places, and it was their conference. So yeah, it was great. I loved it.
It's got a great big area in the middle there, sort of.
The courtyard, yes. And that's actually where the expo was.
Years ago when I was in Barcelona, I went to an event there. Yeah, it sounds fantastic. And did we learn anything revolutionary?
Well, I had a personal learning, I must say. So after Europe, I flew into London, arrived here yesterday, and I had my own experience with the UK health system. 30 minutes before I got on the plane, I was completely fine, not a problem health-wise. As I was about to get on the plane, I was like, something's not right here. And I dismissed it as you do. Anyway, I get on the plane. 2 hours later, by the time I arrive, I am not well at all, like fever, chills, a whole bunch of other symptoms that are too gross to talk about on the podcast, but it was not good. Anyway, I don't tend to be a hypochondriac. I might be an oversharer, but I'm not a hypochondriac. So anyway, so I was like, okay, so I'm waiting for the baggage carousel. I pull up ChatGPT and I'm like, okay, these are my symptoms. This is what's going on. It asked me a series of really good questions. And at first it was like, oh, look, you could see just how you feel tomorrow. But then it was like, but tell me the answers to these questions. So I was telling it the answers to these questions. And it was like, yeah, you need to go see a GP right now. So I'm like, okay. So then I switched to, how the hell do I navigate the UK health system? I've literally arrived. I'm still waiting for my bag and I was so cold. So I'm looking for jumpers and stuff to rug up. And so I managed to, with the help of ChatGPT, find a private clinic. It did suggest the urgent care clinics and those sorts of things here. But yeah, when I said, wouldn't that be a long wait? And they said, yeah, you could be there for hours. And it was already early evening and I just wanted to get back to the hotel. Anyway, so it helped me find a private clinic not too far from where I'm staying that actually could fit me in. And so by the time my bag came out, I had booked an appointment and paid for it and had the address. So I actually went direct to this clinic, which was at London Bridge. I do not travel light when I'm away for weeks on end. So this, I think it was like a 25 kilo suitcase. Anyway, dragging through the streets of London. But yeah, went in there. The GP saw me 15 minutes earlier than I had booked, like within minutes of me arriving, asked me a lot of the same questions ChatGPT had. So not only was the service great, but the cost, I was worried about that. But it wasn't that bad, really. So it was a service called DocTap, and the doctor said they've been around for like 10 years here. And the appointment cost me $140 Australian. Now, I appreciate not everyone could afford that, but when you're sick and you're in another country and you don't know how to navigate, I was really grateful for that. And because if this happened at home, it would have cost me $85 to go see my local GP anyway. So anyway, it's $140. And by that stage, I'm even feeling sicker. And she's like, oh, we actually have the antibiotics here rather than you go find a pharmacy. And I was like, fantastic. Yes. So the drugs were certainly more expensive too, because they were $50. That would have been a lot cheaper in Australia. But yeah, took the antibiotics. Today, I'm feeling heaps normal. I just feel better. So I really needed that. But then also there was a shipping incident at home and I didn't bring enough contact lenses with me. And so this morning I managed to find contact lenses online. They're going to arrive to the apartment where I'm staying. And for a cost of $35 at home, I pay $47 for a box of contact lenses. And they didn't need a prescription or anything. They just trusted me. Anyway, so I've had a good experience with the private healthcare system over here. That I appreciate not everyone can afford it. But and using AI to help me navigate all of this.
Yeah, interesting. A lot of people don't realise that there is a private healthcare system in the UK which is available for travellers, but also for other people. But again, we talk about here the problem we have between public and private, but finding the right balance is often a solution to the problems they face. But I'm glad you're well. I'm glad the health problem's under control.
Yeah.
And the contact lenses are under control. Now enjoy the rest of your time in London.
I will be able to. Oh, and one other shout out. So, I'm not feeling well. I finally, at 45 minutes later, 2 trips on the tube, lugging around my suitcase, get to where I'm staying. And so connect to Wi-Fi. And there's an email from the clinic saying, here's your full clinical consult notes. And I'm like going, holy shit, that is amazing. I have never received my full clinic consult notes ever. And I did ask if she was using a scribe, the doctor, because I noticed there was a big microphone on her desk. She said, oh, yeah, we use a scribe. And I said, oh, well, which one? Because I know Australia's Heidi and Lyrebird just won a huge contract over here. But, there's a million other ones, but they have actually developed their own scribe that they're using. Oh, wow. Anyway, I got my full notes. I'm very happy patient.
Now, if you can work out how to import those into My Health Record, you'll have a GP note in your My Health Record for the first time.
That's right. All right. Anyway, aside from my health experience, which I'm all better now, shall we get into our hot topics, George?
Let's go.
All right. We're kicking off today in New Zealand, and this is a story that means a lot to us on the pod and to our listeners because long-time listeners will remember us talking at length over several episodes, and certainly not happily, about the cuts that gutted New Zealand's digital health program in 2024. We talked about it first on episode 2 of the pod, and today, George, we're recording 71. So a long time ago, they cut $300 million of funding to digital health. So it's great to be reporting on the other side of that ledger today. So as reported by Reece Lyon in Pulse IT, New Zealand's 2026-27 budget has set aside $300 million to fund the first 3 years of Health New Zealand's 10-year health digital investment plan, plus a separate $153.6 million cybersecurity package, taking the total to north of $450 million. Health Minister Simeon Brown says the money goes towards practical, unglamorous, but essential stuff. So replacing aging devices, modernising radiology systems, and upgrading core IT platforms. The cyber funding follows recent incidents, including in primary care, and it's aimed at expanding national cyber monitoring and strengthening protection of patient information. Now, Stella Ward, the CEO of the Digital Health Association in New Zealand, welcomed this announcement, calling it a significant step toward treating digital health as the critical infrastructure it actually is. And her point is one, George, we make on the show all the time. You can't build a modern connected health system on 1-year allocations or even 2-year allocations. It's just too hard. A 10-year program needs sustained multi-year commitment, and certainly this budget acknowledges that. So, George, after years of watching New Zealand go backwards on this, and we had personal friends impacted, is this a turnaround?
Well, like they say, New Zealand is back, and it was really $300 million over 3 years to replace aging devices, which are 3 years older now because they originally were going to replace them 3 years ago.
Yeah.
Modernize radiology systems, upgrade core IT. Isn't really a lot of money when you think about it, especially if we consider the New Zealand dollars only 4/5 of ours. So, $250 million Australian. So in reality, it's really just a return to some of the money they ripped out of the budget in 2024, and that's not taking into account inflation. They did say back then that the funding would be returned, quote, pending work to prepare investment-ready business cases for future investment. So hopefully that's what they've been doing for the last couple of years, getting those business cases in place. But whilst updating old hardware and bringing old software up to date is a important step, there's a lot more work that needs to be done, and hopefully that's what they're going to be looking at. This is not just kicking the can down the road, making the existing systems last for 3 more years. The biggest issue, and we talked about it back in the early days, was that loss of momentum. There was so much excitement at MedInfo 2023 in Sydney when they were announcing their major initiatives, and they were, let's be honest, stealing people from Australia over to New Zealand to help them get their system up in place. And then all of a sudden they lost that momentum. Some of those people were left in limbo. And as a result, fortunately for us, many of them came back to Australia. But I wish them good luck. But the reality is they have to think about this as a real 10-year long-term investment. And this may be an opportunity for us to collaborate across the Tasman more effectively. But the good news is Reece is doing a great job on reporting on New Zealand. So we're keeping up to date with New Zealand on a regular basis, which is great.
Yeah, Reece is a legend. He does a great job. Yeah, and I did note that he noticed as well in his article that the HDIP allocation was described as a capital to operating funding transfer, means that money has been funded by an equity withdrawal from Health New Zealand. So it's not actually new money. So it's like, what's an equity withdrawal? Does that mean they didn't spend money that was already allocated to the budget, or are there cuts elsewhere? I'm not sure.
Yeah, whenever finance and treasury get involved, it gets complicated. But the reality is New Zealand has had a proud healthcare system for many years. And if they let it run down, then picking it up again is a challenge.
That's right. To all of our New Zealand friends, I hope this is a step in the right direction, even if it's not everything that you need. On our next story, we are going over to the UK, where I am physically at the moment. So the next one lands right in the heart of what we talk about pretty constantly on the pod, patients using AI for their own health, as I just did yesterday. There's a major new report out from King's College London, which surveyed just over 2,000 UK adults in late March, so not that long ago. And it's some of the best evidence yet on what the public is actually doing. The headline is that 1 in 7 people, so that's 15%, have used an AI chatbot for health advice instead of contacting a GP or NHS service, and 1 in 10 instead of seeing a professional for mental health support. So what's driving it? Convenience topped the list, no surprise there, 46%. 45% said they were just curious. And this one I love, 39% weren't sure whether their concern was even serious enough to bother a GP. And a quarter said they went to AI because the NHS waiting times were too long. So once again, we're not talking about AI alongside the system anymore. George, you and I have been saying since last year that AI has really now become the front door of healthcare. And for a meaningful slice of the public, that's already happening. It's becoming this parallel front door. But one of the findings that I think should give us pause is that 1 in 5 of those users of AI say something an AI said led them to decide against seeking professional help. Now, we don't know, is that good or is it bad? Without clinical governance, we don't really know. Like maybe it really was just stopping the worried well from clogging up the system, but also maybe other people got bad advice. Now, there's also a real trust gap in this data too, because the public are genuinely split on AI in clinical decision making. So while they might be using it for their own purpose, for clinicians, 37% support AI being used by clinicians and 38% oppose. So it's pretty similar. But strong opposition runs at almost double strong support. So it seems that the public here are much more cautious once you get to the clinical AI, like inside the NHS. What did you make of the data in this report, George?
First of all, I've got to say, how good does it feel when the King's Fund, one of the world's premier research organizations, publishes a report which basically says what we've been saying for 2 years on the
Yeah,
podcast?
yeah.
It took them a while to catch up to us, but yeah, good luck to them. I think they're doing a good job there. Interestingly, England at one stage had a consumer AI tool, a strategy with the now relatively infamous Babylon. May have well been something too early and overhyped, but the reality is, despite that debacle, people are still voting with their fingers and using AI chatbots as a first step. And as you described in your experience, and as the study shows, people are using it because they see it as an advantage going forward. They can avoid the time limitations that are currently available in the NHS. They get answers quickly. And whilst we talk about 1 in 5 were told not to go see a professional, if those 1 in 5 didn't need to see a professional and did use a professional, that would just clog up the system more. So even though they complained about they want regulation, despite the fact there was no regulation, they still continued to use it. So I think that in itself tells you a lot about the fact that the horse has bolted. People are now using AI as their front door, not just to healthcare, but to pretty much anything else. And that's going to play a significant role in new jobs going forward and all that sort of stuff. But they sought help from ChatGPT. And if it gave them enough information to make a more informed decision, it raises the issue. We've had discussions around health literacy and digital literacy. And again, these are tools that will make that better. And it is an iterative process. But I think this report really just highlights the stuff that we've spoke about with Charlotte, Louise, and many other of our guests, that patients are using AI. The healthcare system needs to accept that and work out how to leverage it more effectively. And that I think is where we still have a challenge.
Yes, yes. And I think it'll take a while to catch up. Because, George, you and I were on a panel at Digital Health Festival in the evening, and we were talking about patients' use of AI, and I overshared, as I tend to do, and let people know I've used it. And I was a bit disappointed, really, because I was getting pushback that, oh, AI is not great, it makes a lot of mistakes. And I was like, right, that's true. Personally, I don't need to be told that. But at the same time, felt like dismissive, thinking just like Dr. Google, it's not that great, it's going to make mistakes. And of course it does. And we need clinical governance over these things, regulation, absolutely. But in the meantime, I don't care. Like, I was sick yesterday and it helped me get the help I needed. It also lowered my anxiety levels by giving me a plan and helping me navigate the system.
But it's interesting. I mean, you said a lot of people were basing those comments on old data, and AI is moving so rapidly that a study that was done in 2024 is no longer relevant to the AI we're using today. It's the fact that in 2024, AI was providing us hallucinations. I have to be honest, I haven't come across a significant hallucination in my use of AI in months. Now, again, I don't necessarily do anything overly risky with it, but I use it for healthcare decisions and to also sometimes just deep dive into conditions that I don't understand well. And the reality is now, especially with these new AI tools where you're no longer just using a single AI tool, but you can actually have 3 or 4 AI tools debating with each other. So the horse has bolted. AI is a significant change. It's not just a simple technological change. At the meeting I was at earlier this morning, University of New South Wales, they talk about this is a change in what is one of our core requirements in society, the concept of intelligence. So I think we really can't underestimate the effect of this.
Yeah. And I'd love to see some Australian data on this. I don't know who would do that work because it's probably be a university and they're not going to get funding. And by the time they did, it would just take too long because we've talked about this type of data before on patients' use of AI, but a lot of it has come from the AI companies themselves. They're a little biased, let's face it. So this is truly, like you said, a great establishment, fabulous reputation, been around forever, putting out this, and also shows that it's a priority issue.
Yeah, look, we have to work out some way where the clinical organizations and the patients are using a common platform where they actually have a governance model that covers across that and the ability to escalate as required within that framework. Now, I know Health Direct's doing some interesting work, or 1-800-Medicare or whatever it's called this week in Australia, but that sort of model where they use AI tools on their online services and on their call services, we need to start thinking about a combined AI tool that overlies the healthcare system. And that's going to mean some changes in the way our healthcare system deliver it. Maybe the public healthcare system needs to invest significantly in this as part of their innovation going forward.
Yeah. All right. We will continue to cover this topic. And actually, we've got an upcoming guest from America who is one of the leaders of the Patients Use AI movement. So we look forward to interviewing him and to bringing that episode to all the Pulse Poddies out there. All right, George, our next hot topic, the foothills of the singularity. Well, depending on your frame of reference, the next story will either sound pure science fiction or maybe terrifying or super exciting, and you guys can decide where you lie on that spectrum. Well, at Google I.O., DeepMind CEO Demis Hassabis stood on stage and declared that we are standing in the foothills of the singularity, which is that theoretical point where AI races past human intelligence and reshapes our entire world. Well, Hassabis went so far as to talk about reimagining drug discovery with the goal of one day solving all disease. Now, that's an extraordinary statement, of course, and probably one that deserves a healthy dose of skepticism. Now, diseases don't disappear because an algorithm gets smarter. We still need clinical trials, regulation, implementation, funding, workforce adoption, patient trust, all that stuff. But even if you discount the hype, the direction of travel is clear. We're moving from AI that helps clinicians document care towards AI that helps scientists generate hypotheses, design experiments, identify drug targets, and potentially make discoveries that humans might never have found on their own. George, how do you feel about the idea that we're approaching a point, sounds pretty soon actually, where AI becomes capable of driving scientific and technological progress at a pace humans we've just never experienced before, especially when we think about AI that doesn't just help scientists as it does now, but it starts to do the science itself, generating hypotheses and running research with limited human input.
Look, we know there are a lot of hype prophets in the AI space and won't name them in fear of being sued, but I don't think Demis Hassabis is one of them. And I've always been a big fan of Demis Hassabis. And the fact that a Nobel Prize was awarded to him in chemistry says a lot in and of itself. So I find this to be quite an amazing prediction. Now, if you go back to the original discussion around the singularity, Ray Kurzweil, who again was well-known scientist in this space, brought up the concept of the singularity in his book, The Singularity is Near, where he talked about non-biological intelligence surpassing human intelligence. So basically the AI is smarter than us carbon-based life forms. And the concept of this artificial general intelligence, as they call it, is not a new idea. It goes back as far as Turing, but it really has progressed exponentially over the years. And the key to that growth has been the fact that the software is now getting smart enough to iteratively improve itself. So it no longer requires the developer to write fantastic code that makes it smart, but the system itself is writing its own code to do that. And that's one of the things we've seen over the last year or two, this improvement in the coding capability of some of these AI tools. This is the sort of thing you start thinking, Arnold Schwarzenegger and Terminator about. But the reality is, what Demis Hassabis was talking about at the I.O. was around their development of an agentic science tool where they're using multiple AI tools in a sequential way with multiple agents being involved to not just simulate the scientific process, but to make it better, speed it up, provide multiple hypotheses. The old scientific process was you started off with a hypothesis, you ran a bunch of tests, you either proved the hypothesis or you disproved it, and then you moved to the next one. Some of these new tools are now allowing you to do dozens, if not hundreds of hypotheses in parallel. So we're now moving to a whole new world where we can do scientific discoveries. Drug discovery is just one, obviously a very important one from a healthcare perspective.
Yeah.
But the ability to better understand the basic biology of human cells requires this sort of parallel processing. I think it's really exciting. The one quote that I did find a bit scary in his speech was my economist friends, I feel, are still not taking this seriously enough. That needs to change. So the fact that this is going to change the economic fabric of the way we do things like drug discovery, the way we do things like innovation is really going to be a new and exciting but slightly scary role for all of us to take into account.
Yeah, things will be moving very fast. We're going to have a couple of stories after our break about predicting disease before it even strikes. So we'll come back with those stories and more after the break. George, we have spent decades in healthcare building healthcare systems that wait for people to become sick before we intervene. But these next two stories suggest we may be heading towards a very different future, one where AI predicts disease years before symptoms appear. Now, the first comes from the UK, where researchers from Predictive Health Intelligence have developed a new approach called the Cumulative Liver Damage Index, or CLDI. Now, instead of looking at a single blood test result, the system analyzes years of historical blood test data to identify people at risk of serious liver disease much, much earlier than current methods. The goal, of course, is to detect disease while there is still time to intervene, rather than waiting until patients present with advanced liver damage. And then along those same lines, we have another story where that idea, predicting disease, it just turns the dial up to 11. We've got In Silico Medicine, who we also discussed on episode 1 or episode 2 of our show. In Silico Medicine have teamed up with Human Longevity to build what they describe as the world's first large-scale foundation model for longevity science. Their ambition is to combine genomic data, imaging, clinical information using AI to predict diseases such as cancer and other age-related conditions, potentially decades before they would normally be diagnosed. Now, of course, it's easy to get carried away with these types of announcements, and predicting risk is not the same as preventing disease, but the bigger trend here is really fascinating. I personally really hope that healthcare is going to shift from diagnosis to prediction, from treating disease to identifying risks, from episodic care to continuous monitoring. But for this to happen, we need business model changes. And we also need to make sure that the health systems themselves are ready, because predicting disease is only useful if you have somewhere to send people to, interventions that actually work, and clinicians who know what to do with that information. And our healthcare system isn't even close to coming up with business models to do this. And not because it's too hard, it's politically difficult, because if we have to say we're going to fund what we do differently, that means some people are going to lose funding that they currently have always relied on. So I get why it's complicated, but it's doable. What do you think about these stories, George?
Again, some very good news stories, a couple of examples of AI doing good by predicting disease, and they do it in very different ways. So these are very different methodologies. I particularly like the liver disease study. I'm always been confused by the plethora of liver function tests. When you get a liver function test, you get 6 or 7 blood test results that sort of all relate to enzymes being produced by your liver, and whether there's too much of them or too little of them, and the end product being bilirubin, which is whether there's too much or too little. And it was confusing to get a single set of LFTs. You looked for patterns, and we were taught to understand some patterns, but the liver in itself is an amazingly complex organ. The number of functions that the human liver does in this 2-kilogram piece of red meat, which other people fry up in a fry pan for dinner, is amazingly complex. The reality is that most people with hypercholesterolemia, high cholesterol, that is as much a liver dysfunction as it is anything else. So understanding what the liver does. And then we have a new series of disease. The new acronym for it is MASH, Metabolic Dysfunction Associated Steatohepatitis. Used to be called non-alcoholic steatohepatitis, or the colloquial term was fatty liver, but it's an epidemic which is becoming more significant, but the findings for it are very subtle. So there are no single liver function test results which show that you have it, unless you have it at such a bad stage that your liver's 80% decrepit, you're lining up for a liver transplant. But the reality is you see these small shifts in your liver function test over time, which is what this test is picking up on, and then trying to work out, are they significant or not? As a single clinician, unless you're a specialist hepatologist, and even then I've got some very good friends who are gastroenterologists, they tell you that they often look at these results and they end up doing liver biopsies and other very invasive tests to look for evidence of disease. So the fact that we can now use this test, it shows the benefit of longitudinal measurements. Maybe we can integrate this into something like My Health Record, so that if you are getting these results from various labs over various years, the expectation is someone's going to go in and look at all those results. The fact is that the data in the system may well be able to not necessarily diagnose it, but highlight to the next practitioner that, hey, Mrs. X or Mrs. Y has had 12 different liver function tests, and look, this trend is something of concern. We should look into it. So I think that test, it's a great example of analyzing big data, using machine learning, all the things that we know AI can do well now. The second article is a bit more ambitious, teaching AI to spot the earliest signs of disease and biological decline long before the body begins showing obvious symptoms. Sounds pretty impressive. The two companies that are involved, in Silico, who we've talked about beforehand, and also Human Longevity, who we've also mentioned before in our podcast. That's the company that was formed by Craig Ventnor, the guy who did the first DNA sequencing. Both very interesting companies. And the fact is they're focusing very much on a large market. We talked about the health span market. We had our good friends from Hevolution on a couple of weeks ago talking about this. They're basically taking it to the next stage. So they're doing what I think Hevolution is also aiming to doing, is building up a data set, using all the tools they have at their disposal to leverage that data set to get information that is not currently available. So I've got to take my hat off to them. It's a big, hairy, audacious goal. I hope they succeed. Yeah, I do worry sometimes that companies that are reliant on these sort of big announcements to raise capital. Although I did look at InSilico's capital raisings over the last couple of years, they don't seem to have budged very much on the stock exchange. So maybe it's not as volatile a market as we think it is. But I think we need to make sure that they deliver on this, but also they deliver on this in an open format. What we don't want to do is develop yet another black box of AI medicine that sits behind a facade that we don't know what happens in the background. Recently, the WHO released a paper around the use of precision medicine, and they talked very much around collaborative models. Again, recognizing these are private for-profit organizations, so they obviously have an incentive to keep this sort of information proprietary. But if we can find a way to make this available to a greater population, the reality is predicting disease models have greater benefits in areas or in countries that don't have access to high-level healthcare like we do in some of the developed economies. If we can help them avoid the burden of disease early, I think we've got an opportunity. So to summarize it, I think they're both great ideas. We watch them with great interest. I think we should actually follow this up. We've had lots of discussions around the longevity field as well.
We have.
This may be one of the areas where AI can shine, but let's just make sure we temper the hype a bit and make sure we keep this as a open, equitable solution going forward.
Agree completely. But I think what all these stories combined that we talk about often, which is why I love that we bring the science into our show as well, is just we are just on the precipice of so much change. Some of us in the audience will remember before the days of the internet. Yes, kids, there was such a time. We used to have to physically go to libraries to learn stuff, or we just didn't know stuff. We'd be like, oh, I wonder what is that? I will never know the answer to that because we didn't have these machines in our hands that would give us the answers to pretty much everything we ever wanted. And if you look back when this all started, to think of where we would be in 2026, it's just, for most people, unbelievable. And I think this next 10, 20 years is just going to herald an entirely new frame of reference for how we live in the world and relate to each other. And some of that will be good and some of it will be not so good, I suspect. But these scientific developments and potential developments are really exciting.
The last couple of stories also melded into each other, because if you think about if DeepMind develops these AI agentic tools for scientific discovery, and you start adding this to these huge data sets that are starting to get to evolve, and things like the UK Biobank and the shared information, the fact that we now have patients using this in real time, so we get real-time feedback, it's a really dynamic world. The challenge is, are we able to keep up with the pace of change? There's so much happening, and it's so easy to just be overwhelmed by the pace of change, and you just basically throw your arms up in dismay and think, I can't keep up with this anymore. I think it's really important that we ensure that the people involved in healthcare have the skills to keep up with this, and we have the tools to make sure they keep up to date. You and I spend inordinate amounts of time trawling through the literature, and we do this for a podcast. We don't do this to save people's lives. So we think, we really need to think about how we make sure that the people who need to be on top of this have the capacity to do that.
Yeah, I agree, George. And I love we get to talk about patients. We talk about AI more than we ever thought we would when we started this podcast. But I keep telling people we do try and find stories that aren't all AI related, but bringing in the science and what AI can do in terms of not just the smarts of it, but even just the ability to crunch the quantum of data and stuff that a human would never be able to do in a lifetime. So yeah, I love that we bring in these discussions of patients' use of AI, clinical use of AI, the business models of healthcare, and the science as well of health.
And I have to admit, I'm using AI tools to make this information easier for myself to comprehend. So I'm a big fan of Google's notebook. So I think the fact that we have all these tools available nowadays is amazing. I'm just concerned that we don't become overwhelmed by them. But having said that, we find new uses for them every day. And so today's hot topic stories just highlight the fact that, every day there's something new and exciting coming out that's driven by AI, but also driven by scientific curiosity and the need to improve health outcomes. So I think we're all in a good space here at the moment.
Yeah, that's right. George, do you have any recommendations for people today?
Look, we talked earlier about Demis Hassabis. I've been reading the book, The Infinity Machine, about his work. So I think that in itself is a great read. But really, it's just start playing with AI tools. When we first started this podcast, I was an AI skeptic. I've become more and more an AI fan as we've gone along, purely because of my exposure to them. So I just recommend to people, just play with tools. What about yourself, Louise? Other than traveling around Europe?
Oh, yes, that's all very good.
Prague, I understand you highly recommend Prague?
Yes, Prague was amazing. Yeah, I can see why everyone goes, oh, I love Prague, whenever you tell people about Prague. And I'd never been before. So, yes, that was really lovely. I can see why everyone raves about it. I went to an old library in Prague, actually in a monastery. I love visiting cities and going to old libraries in this part of the world. But aside from that, George, I did just want to give a shout out to an Australian company that has won a pretty prestigious award, as again covered in Pulse IT. Australian mobile clinical decision support tool provider ThinkMD.ai has been awarded US $200,000 because they won the Future Health Challenge 2026, which is an Abu Dhabi-based program. ThinkMD was co-founded by Dr. Jackie Rebeck. They equip frontline health workers with mobile decision support tools to improve triage, treatment referrals, and all those sorts of things. They also use the data they collect to feed into real-time population health signals. They have worked in all sorts of places around the world, and it was great to see them being recognised. Jackie said that their next stage of growth is going to be expanding in priority markets across Nigeria, Rwanda, Uganda, and Somalia. And they're looking at this next generation multimodal conversational interface. So I just wanted to give them a shout out. To be acknowledged at the World Health Assembly in Geneva is amazing, and great to see yet another Australian startup just kicking goals.
Yep. And look, I've followed Jackie Rebeck's career. She's had quite an interesting career in healthcare. I think if anyone has an opportunity to follow through, she was one of the original presenters at Creative Careers in Medicine many years ago. Kudos. And their solution is one that is based on equity. I mean, this is providing tools for those people who really don't have access to the things we have here. So big shout out to them. Well done.
Yeah, that's right. All right, George, until next time, could you please read us out?
Sure. So next time, we'll find out what part of the world you'll be in next time we have this conversation. Thank you all for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thank you to Emily Maurer for her support. Big thanks to everyone for listening. Make sure you subscribe, follow, and rate us wherever you get your podcasts. Visit pulseit.news to catch up on the news from Australia, New Zealand, and Ireland, and send any feedback or topic suggestions to pulsepod@pulseit.news. We'd love to hear what's on your mind. See you soon.
See ya.